Well, we can go ahead and get started. Welcome to the very first session of the day for the executive track. And the name of this session is called What is Your Beta Strategy? What is your big data strategy? So just want to make sure you're in the right room. My name is Amy Tong. I am the Deputy Director and Chief Information Officer of California Lottery. It's my honor today to moderate this particular session with three outstanding speakers that will be joining us. Let me start by introducing our panel speakers, starting with, to my left, Dr. Linette Scott. She is a board-certified physician in the public health and general preventive medicine with a Doctor of Medicine from Eastern Virginia Medical School and a Master in the Public Health from the University of California, Davis. Dr. Scott is the Chief Medical Information Officer for the Department of Healthcare Services. Highlights from her career include serving as the Interim Deputy Secretary for the Health Information Technology at the California Health and Human Services Agency, and the California State Register and the Deputy Director of Health Information and Strategic Planning at CA Department of Public Health. Whew. All right, and more to go. And of course, a General Medical Officer with the United States Navy. Let's give it a round of applause and welcome Dr. Linette Scott. Next, we have Mr. Jim Hasegawa. Jim is the Deputy Director of Business Planning and Research and has been with the California Lottery since 1989. Jim started when he was 12. In his current position since 2007. Over the 24 years with the Lottery, Jim has also held position as the Scratcher Product Manager, Chief of Product Development, and Deputy Director of Marketing. Prior to joining the lottery industry, Jim worked for a marketing consulting and marketing research firm in the Los Angeles area. He holds a BA and an MA from University of California, Los Angeles in political science and public opinion. Let's give a round of applause for Jim Hasegawa. And of course, representing our sponsor for today's panel, Informatica, is Mr. John Dutt. He is the Senior Director of Big Data Product Marketing at Informatica Corporation. He has over 25 years of experience in developing and marketing enterprise applications. Today, he advises the organization on big data best practice from a management and technology perspective. Prior to Informatica, John was the Director of Product Marketing and Management at Right Hemisphere, acquired by SAP. That's a disclaimer, and held various positions in R&D and business development in Oracle Corporation. John graduated from UC Berkeley with an AB degree in applied mathematics. Welcome, John. Next, I'd like to turn over the floor to our panelists, and if each one of you panelists could give a brief introduction of yourself in terms of your involvement in the whole big data arena. Let's start with Dr. Scott.
Okay, thank you. Well, thank you and welcome to this session. We're very pleased to have you here. The bio, is the bio part of it, and it's always sort of funny to hear it read about yourself. But the big data environment, we'll talk about this a little bit more, is something that is defined in many different ways. Pam Lane talked about that a little bit in her opening plenary, and as well as the Intel video. But some of my experience around big data started with my undergrad in physics, and I went into medicine where we had lots of data and lots of things to memorize and learn and regurgitate. But then coming into state government, I came into the state government around vital records. And in vital records, that's all of the births and the deaths. So we register all births, deaths, marriages in the state. And we have it back to 1905 and earlier. So in the context of that state registrar perspective, we essentially had the oldest data set around how we understand the population. We've been using mortality data for centuries in terms of understanding what affects the health of the population. And the challenge, though, is that much of that is very much still paper-based. So while we have vital records data electronically for the last few decades, we have data on paper that's falling apart in some places, working on imaging that goes back for hundreds of years, depending on where you are in the world. And so data is one of those things that's very interesting. How do you make sense of that? What do you do to make it usable? And so I had the opportunity to work in public health around the different public health registries, which in general, public health has a lot of very structured data. And then in the last year and a half, I got to move to Department of Healthcare Services, where we have our Medi-Cal program. And there, too, we have a lot of structured data, but we also have a lot of unstructured data. And that's part of the move over this last couple years that Pam mentioned in her plenary, of really trying to bring automation to healthcare. And so part of what makes it personal to me is, as I worked as a general medical officer and a clinician, I had a mixed record. I had folks show up with their paper, and the younger folks, it generally was thinner, and the older folks, it was generally thicker, but not necessarily based on age. But we had some things that were electronic. So even if they didn't show up with their record, I could often go in the computer and see what medications had been prescribed, when had they been in for a visit. And I could get about 80% of their medical history based on their medications and their labs. And I could get pretty close. But it wasn't the same as really having that medical information. And I did some moonlighting at a clinic that had been started by a Navy doc when they left the military. And this was now 10, 15 years ago, a while ago now. And that set of clinics, they had set up, it was kind of cookie cutter. Every clinic had the same exact floor plan, the same exact layout, the same exact computer terminals, DOS-based, green screen, type thing. But the mission was get people in and out the door in 30 minutes, and nothing was paper except the prescription we still had to print out and sign. So when somebody was registered, it was all electronic. And being a Navy doc, then doing some work on the private side, getting to that last screen that says, make sure you document this, this, and this in the record, so that when you bill a 99-204, you're not committing Medi-Cal fraud, was awesome. Decision support, the ability to put the intelligence and that extra information behind the data, being able to see the trends and know not only that they'd had thyroid tests, but here's all the results over the last 5 times it was done, was incredibly powerful. So even in that DOS-based world where you had to type it in and know a little bit more comfort around the codes, it was incredibly powerful to do that. And so now as we're moving 10, 15 years later, the opportunities around data, the use of data to support decision making, to support appropriate care, and to really get at outcomes and quality is really tremendous. And so our role in government is to help support some of this transformation in the healthcare industry. And we also provide a great amount of contribution through the services that we directly support. So we have huge opportunities, and it's really exciting to be able to be a part of that, working both with the private side, with our clinician and our patients and our members, as well as working on the government side, where we're taking a lot of paper-based, a lot of very old 20, 30-year-old systems, and trying to get that productive data out of it. So it's a real pleasure to be here, and look forward to the conversation.
Thank you. All right, Jim?
All right. Well, I've been around, I guess, data analysis before it really was big data. And there was all these separate information sources and all, because I've been involved with marketing, first at a marketing consulting, marketing research firm, and then subsequently at the lottery, to help make decisions in the business. Which products to introduce, which products are best geared for which type of demographic or different player segment and all. And so I think, making good decisions really requires good information. And I think that's how I came into this area of big data. Because, for any business to increase revenue and increase profits, you need to make great decisions, and great decisions come from really having sound information to make those decisions on. And I think similar to what was discussed earlier today, I think, because of the various backgrounds I've had, of intersecting some of those skill sets of both understanding the business side and what drives the business and what drives sales, but also understanding data analysis and statistics and so forth, as well as being able to communicate on both sides of the fence to not only technical people but also business people, kind of landed me in this role at the lottery of involved with our projects on big data, being able to communicate it to both parties. To really ultimately, our mission's pretty clear at the lottery. We're to create revenue through the sale of our products, to deliver profits to public schools throughout the state. And so we have a very clear mission and mandate. And as such, we need to increase sales, but also do it in a very profitable way. So I think big data can help us do that. And so that's where I think I fit into the picture of really trying to provide that bridge between our marketing people, to which I used to be a part of, and to our IT people who are enabling us to use big data.
Great. Thank you, Jim. John?
Yeah, thank you. It's a pleasure to be here with Dr. Scott and Jim. Big data, we heard in the keynote that big data is really big. How big is big? Zettabytes. If you add another 3 zeros to the zettabytes, you're looking at yottabytes. Okay, so that's the next step beyond zettabytes if you're curious. Yeah, not from Star Wars, but yottabytes. But there's all this emphasis about big data being big, but it's actually the biggest challenge is not just the volume, it's the variety. There's so many new types of data that are out there today. I talk to a lot of different companies in commercial and public sector. And we have companies that are 160 years old that have mainframe computers, right? So all this data is cumulative, right? It's being, I know, and the agencies have mainframe computers, and there's data from, decades old. So you have that. You have application data, but you also have all these new types of data: social data, mobile device data. Each of us is carrying sensor devices with us. These mobile phones or smartphones that we carry with us, that's all a sensor. I mean, it knows where you're going. If you have one of these Fitbits or Jawbones, it can track, how many steps you take a day. If you're putting in your 10,000 steps a day, it can track your sleep patterns. All this massive amounts of data. What do you do with it? And it has to start with the business goal, right? We heard that also in the keynote, that Dr. Scott pointed out that their goal was they had this $1 billion being lost to fraud, abuse, and waste. And what can we do to reduce that? And by looking through the data, they were able to reduce their expenditures by 30%. That's a great goal to have in analyzing big data. So yes, there's a lot of data. There's a huge variety of data, but also dealing with the velocity of data in real time. So if I'm analyzing Twitter data because Joe Smith just tweeted about his new boat that he bought, and he's also on disability, well, what's going on there? So if I look at that type of data, maybe I can catch some more fraud. So, but in order to do that, I have to monitor the social data in real time. So. And I guess just a little bit more about myself. So you gave my bio, thank you. It's interesting, my first job out of college was, I guess I could call it a data scientist, although we didn't call it a data scientist. I was a scientific programmer, and I was working at the VA. And I was analyzing electrophysiological data, EKGs and EEGs, and trying to sift through the data, look for patterns, look for anomalies as part of clinical trials. So I have a deep felt interest in data from a technical standpoint, but also from a business standpoint.
Great. Thank you, John. All right, for the rest of the session, the advisory board member who are putting together this panel have put together some questions to help carry the dialogue over, covering specifically on what is a big data strategy. So we're going to take turn to ask our panel member, to talk about those topics, and we want to make this session as interactive as possible. And that's not involving you guys doing any wave dance when I see people nodding off, but anytime during this topics, if you have a question or you'd like to have a comment or feedback, please just raise your hand. I have a pretty good eyesight today, so I can make sure I can capture everybody's attention. So with that, I want to do a quick recognition of the advisory board member who put this panel together. So I know Bill, Keith, and Ryan. Would you guys quickly stand up so everybody knows who you are? But more importantly, more importantly, if these questions do not target what you were here wanted to hear, those are the guys you're going to have to blame. Okay. So with that, Dr. Scott, if we could start with you. Mm-hmm. How do you define big data in the context of California state government?
So we've already heard several definitions of big data. And as John was mentioning, you know, I did what Pam did last night too. I did my little Google and make sure I had the right terms. The volume, velocity, variety is one of those definitions out there around big data. But I think one of the challenges we have in state government, and certainly as I've thought about this, is that there's what people think of as big data. So all of that social media, the purchasing power, you know, how does Target know that your daughter's pregnant before you do? That was a news article sometime recently. You know, that people think of big data, and that's what they tend to think of as big data. And some of our healthcare sort of description is like some of the things that were being done to monitor flu. How do you have an idea that a flu outbreak is occurring? But that all kind of happens in a way outside of government. We'd like to take advantage of it, you know, to be able to bring that together, not just from a kind of a fraud detection perspective, but also from a treatment and coordination of services perspective. But within government, I think big data really, the definition that kind of rang true for me is when you need to apply new tools and different tools than you have currently applied. And we definitely have that experience because we do have mainframes. We do have systems that weren't built to produce data reports. They were built to pay invoices, or they were built to register people for a program. They weren't built to do data analytics that assess how many folks got services on this day for this reason and let us look at outcomes to see if the intervention we did worked. That's not what they were built for. So anybody who's worked around data knows you can only get out of it what you decided to at the beginning before you started collecting. I mean, and some of our big examples are things, you know, again, I'll use some of my examples. Vital records, we collect race and ethnicity based on the Office of Management Bureau National Standards, which says you collect race and you collect ethnicity. They're two data fields. They're two different things. There's specific ways of coding it. Our Medi-Cal application, whoops, sorry, talk with my hands. Our Medi-Cal application, at least before this year, had one box that said enter your race ethnicity. It did not distinguish between the two. It wasn't two different codes. So if you want to compare race and ethnicity of Medi-Cal members to look for disparity compared to, say, a vital records data set, you don't have apples to apples, you have apples to oranges. And so it starts at that data collection, how you design your form, where does the data come in? And so the challenge we have is now we want to analyze data that we didn't want to analyze before, so we need to apply new tools that we haven't used before. And in that sense, I think that's where we really kind of tag into some of this big data conversation, this need for data scientists that are going to think very differently about what we can get out of the data because it wasn't designed for that. And how can we put those things on top of what we've got, so to speak, that middleware, the portals, my techie terms get a little vague here, but you know, so that we translate it, make it usable, so the smartphone can pick it up and help find the service that you're looking for. Where is that support group for the veteran that just returned, or the new mom in the community that's not quite sure what to do with this thing that cries and pees and poops and wants to eat? You know, it's tough, and there are lots of services, but we don't do a good job of making the data about those services available. So big data, I think, in government, we need to think about it from that full range in terms of both how do we take that paper stuff, that mainframe stuff, and make it really available in a world of smartphones and a world where texting is the best way to reach somebody so they get a service, not that archaic thing that we put in the mail with a stamp, right? Because they move around. They may or may not be there. Maybe we have the right address, maybe we don't, but more than likely people, if they're going to have anything, will have a phone. And that is becoming one of the things around how we communicate. So we have to rethink. So big data, I think, in the context of government is, yes, all those things that are being referred to, but it also ties into this translation between what we've had and where we need to be, and how do we apply new tools to that, to the structured, the pseudo-structured, and the unstructured data in our repository and outside that we need to link up to. And then also the other kind of three phrases I want to throw in there is also how we look at the data we have in terms of its integrity. One of the things I think in government, there's a different expectation for us with respect to data compared to outside of us. It has got to be right, it has got to be accurate, and the expectation is that we will do that. There is also the expectation that if it is meant to be confidential, it will remain confidential. That's part of our trust in government with our constituents and the folks we serve. And then more and more the outcomes and the transparency in terms of accountability. How do we know that the service we're providing really is making a difference for those that we are serving? So our perspective on data, I think, is a little bit different than outside of government, but we have the same opportunities to do really new and revolutionary things that are happening outside of state government and local government and federal government. So big data is a big area with lots of opportunities.
So with that,
I was just going to add, that was a good, add-on to the definition. And I think it's also the democratization of data, right? Because we've always had, data and computing power and supercomputers, but to make it more widely available and accessible to more people, then there's new and interesting things you can do with it. So.
And I think related to that is that I think it's big data now because it's more than individual sets of data that different people use. It's really trying to combine all of those into one big element so that you're being able to correlate all the different variables together, rather than previously, data had always been in certain areas or silos, yeah. and that group of people use this data and this other division use this data, and now it's really trying to get into some common pool so that you can really look at any possible behavior, attitude, segment of the population and correlate those to some other attribute. So
yeah, the sharing of data is what makes it so much more powerful.
Yeah.
Right.
Speaking of the powerfulness of the data, Jim, could you speak to how could data be tied directly to an agency's business strategy?
Yeah, I think definitely it can be. I mean, it's critical so that way that the business start looking at how it needs to make best decisions, and at the lottery, our business intelligence, business analytics system, our big data really is a central part of really building our infrastructure at the lottery, because it's going to enable us to do a variety of things in terms of marketing our products better, in terms of doing so, marketing our products at a cheaper cost, actually. I'll talk a little bit more about that later, but essentially we're going to be able to, with all the big data and all of the technologies that we have available through the website and through cell phones and so forth, be able to talk directly to our customers with customized messages, so that way we don't have to spend the same type of dollars we have in the past on television and radio type of marketing communications. We don't need those media vehicles because we can now provide information that customer wants, and do so in a motivating way directly to him or her. And I think that's why it's central to a business's strategy to figure out ways that big data will enable you to do things that you couldn't do before.
Yeah, it'll also help me pick the winning numbers. Right?
Fortunately, not that, but.
No, yeah, we're all secret millionaires who works for lottery. So again, coming back to the data, I know a lot of folks, I'm an IT background, and a lot of folks here are, we have a representation from business area and technology. We heard a lot about big data, but what is truly the difference of big data as an overhead, big data just become overwhelming versus data truly being treated as an asset. John, could you talk about that?
Yeah, if we considered, using data in the past, it was just a cost of doing business. We had to produce a report, whether it was a shelf report or just a report, for compliance, for financial reasons, for forecasting. And that's a cost, right? That's an overhead, right? There's no, it can help us make decisions better, but we're not really measuring that in terms of the data or correlating it back to the data. So the way you turn data from an overhead into an asset is you tie it to the business impact in terms of the key performance indicators that you're striving to improve, right? Whether it's reducing fraud, or lowering the total cost of care, or catching the bad guys, right? When you can connect the data to the end result, and now we can do that, right? I mean, if you consider, reducing fraud, and what information do I need to help reduce fraud? Okay, well, if this is the information that I need to do a better job, what data do I have access to? What data do I need to get access to? And how do I need to link it and transform it to get that information to the people that can make the difference? That's connecting it back to the data. And when you have, clean data, reliable data, secure data, then you can associate a value to it. And that's how you turn it into an asset as opposed to an overhead.
Mm-hmm. So that's a good segue to Dr. Scott.
I think there's a question here. I'm not sure if we're taking questions
yes.
yet. But
Taking questions?
yeah.
Yes, you do.
The linking of the data that you discussed and linking of relevant data. We're looking at metadata right now as big data. And I'm trying to find some information if the state is working on a metadata taxonomy that maybe for these links that we can actually have, that what's relevant or what we're using so that we have these links, these hooks that we can grab on.
Yeah, so metadata, so does everybody know what metadata is? I know some of you really do. Metadata is basically just to level set, is basically your card catalog. So if you went to the Library of Congress and went to the paper-based card catalog, that card that says, here's the title, the publisher, and all that, that's your metadata. And ideally, every data set would have a fantastic set of metadata that went along with it so that you would know when it was collected, how it was collected, what the data definitions were for each data field, and then be able to compare one data set to another and know, can you use that data field to link or not because it's defined the same way or not. Unfortunately, that's not something we've done a good job at. And I'm going to use the really global we in this case. Because when you go looking for metadata about data sets in government, it's hard to find them. And there are a number of standards. Actually, I would say within the geospatial community, there's been a lot of work around the standards around metadata from the Federal Geospatial it's been a while since I've looked at the acronym. But also Dublin Core is another one that's been used for outside of kind of the geospatial. So that is definitely something that's being looked at, and actually state library folks have been really looking at what might be a standard for metadata in government in California. But there's not a specific one that has been identified to date. So I want to do the reassurance that yes, there are people that are I think, as passionate as you sound about this, that are very much engaged in the conversation, but there's not a simple answer right now. So yes, definitely an issue.
Yeah, good question, because if you can't find the data to begin with, then, and that's where the metadata helps, right? Yeah.
Good. All right. Thank you. Moving on. Dr. Scott, speaking of, if we can really manage the data as an asset rather than treating them as an overhead, and it has a good, ultimately at one point of a good metadata, start defining these in a way of retrieving it. What do you see as what would be some benefits to the public sector of having a good data strategies? So
data strategy is another one of those terms that is, I think, kind of like big data, in that there's a variety of definitions out there. But the basic is having a strategy that's pertinent specific to your data, as opposed to the business or the technology. And I'm now with the Department of Healthcare Services, which is our where we have our state Medicaid program, and the federal side has actually done a lot of thinking about this, and they started off actually with the federal enterprise architecture, which I hope many of you are aware of. But then for Medicaid agencies, the Centers for Medicare and Medicaid Services developed the Medicaid Information Technology Architecture, which is based off of the federal enterprise architecture. And part of that, though, talks about the difference between the business processes, delivering services, how we engage with patients, members, do our contracting, our budgeting, the information architecture and management, and the technology architecture and management. And so within the information architecture and management, information architecture is defined as part of that framework as starting off with a data strategy, having a conceptual data model, a logical data model, and data standards. So those are kind of the four main components. And in that context, data strategy, they talk about data strategy. Part of it is knowing where do you fit into the ecosystem in which you are part of. And so in healthcare, part of the transformation for us has been this adoption of electronic systems. So where do we sit, state government, local government, government in general, with this ecosystem where the healthcare community is transforming as we speak from a paper-based to an electronic-based organization? What does that mean for us in terms of our data strategy? How do we need to interact, both in terms of that information portability, data that needs to move, but also where do we sit with respect to protecting information and making it publicly consumable? So as Pam talked about, HIPAA is Health Insurance Portability and Accountability Act, but a lot of folks know about the privacy, and one of the things that's, HIPAA has been updated a number of times over the years, most recently with the HITECH Act as part of American Recovery and Reinvestment Act. And part of that is saying you, as a patient, so each and every one of you have the right to have access to health information about you from your providers, from your health plans, from those that have that information. And now, if it's electronic, you have the right to get it electronically. Yeah.
I didn't know that part
So
of
if you
it.
go to the Federal Office of Civil Rights, there's all kinds of great videos structured for consumers, and it talks about having that right. And so what that means for us is that we need to be rethinking how we organize and provide that information. It's changing the expectation as well. So the same way there's an expectation that you can now bank on your cell phone and do that, and you can deposit a check on your cell phone, the expectations are changing in our healthcare industry as well. And so that means changes for us in government. So data strategy is where we start to have a place to put that together and say, yes, this is what we're about. And the challenge, though, is how to make it understandable. And I'm not going to pretend to have the answers because we're living that question right now within our organization in terms of what makes it understandable. But part of the framing, I think, is that outcome piece. So again, as Pam mentioned in the Let's Get Healthy California Task Force, one of the structures or the framing was something called the triple aim, which is improving healthcare delivery, so quality, a focus on quality, a focus on outcomes, the health of the population, and cost and containing cost. And so that triad is sort of our base that everything sits on. So when we think about our data strategy, it's in that context. We want to be able to deliver high quality services and be able to demonstrate that we're delivering high quality services, control cost, manage cost, and improve the health of the population. So when we think about that, all of our approach to the data is going to be around that. So your data strategy ties your goals as an organization, your strategic plan, for us, our quality strategy, to how you're going to manage your data, and it's going to then help drive your technology base that supports your data. But we also, think about data from a sort of a tiered approach. There's the public or publishable version. There's the confidential, you can't share it version, and there's the in-between, which is it's shareable for these purposes with these folks so that we continue to protect both arms of it. And one of the, I think we've done a good job at the protecting part. What feels insecure, I think, to many folks is as we think about the publishable part. Where is that safe zone to publish in a way that's understandable, and recognizing there is so much more data out there that can be linked to that puts things at risk of re-identification. What does that mean for us? There's that whole other zone. And yet, as government agencies, we have a responsibility to those that pay for us to provide services, to be accountable, and to provide information. So data strategy is where we get to put that together, and having that conversation and being able to have some structure around that conversation, I think, is one of the biggest benefits to the data strategy, because it hasn't necessarily been an area of focus over the past years. You know, we worked on automation, we had a lot of focus on technology, but the actual data information arm of it, that where we need those data scientists, I think has been a little bit on the neglected side. And so that's an area for us to really have opportunity as we move forward.
So we have a vision or an angle of what we're trying to achieve is to really for each agency to develop a data strategies or data strategies, as we move forward. The next couple of topics we're going to cover, it's from beginning to end. How do we get there? So with the beginning, I'm going to ask the panel member to maybe just as a way of something for our audience to take away as well. What are some succinct steps? Starting with the very first question, Jim, what would be some of the best ways to actually initiate a data strategy?
I'll first talk about it kind of generically, and then I'll provide some examples, of what we did at the lottery. But I think essentially, to have a really successful data strategy, you have to really start out with a very focused area that can provide immediate value to the organization so that people can see the importance of having a data strategy, that can be grown over time. And I think there's three elements to it. First, it's helping us to solve a critical business issue. Secondly, it's the new data strategy. It's going to provide some information that currently is taking significant staff time. We did. So that way people see an immediate benefit of saving time. But yet at the same time, it's going to provide new information to provide kind of a deeper understanding or deeper insights into the business issues. So it's a combination of all those three elements, I think, to initiate the data strategy. And that's why it became very successful at the lottery, so much so that now it's hard for Amy and her team to keep up, because now we have so many different business units wanting to be part of our business intelligence, business analytics system. So let me give you a little specifics. For us, the business issue we chose is helping to increase our scratcher sales, particularly in the area of getting our sales staff and our retailers to display the best-selling games. One of the unique things with why Scratchers was chosen is that you might think we have all kinds of data on our sales of our products, of Scratchers products. But if you think about it, when you buy a Scratchers ticket, it's never recorded anywhere. It's not like the retailer does something to it. It's very different for when you buy like a Powerball ticket or a Mega Millions ticket, because it's coming out of a terminal that is connected to a central system and the data is captured. But for the Scratchers tickets, the retailer just tears it off the thing and hands it to you, and you give them cash. It's never recorded anywhere. So for us to measure consumer purchases, we have to apply various algorithms to the win scenario, because we know the odds of winning certain prizes in the game. And so we can take those algorithms to estimate what consumer purchases are actually happening. So that takes quite a bit of math. And so typically, the first area I said is like, help us reduce, kind of provide value in the area of saving time. What used to take staff, about 2 to 3 staff people, pretty much not all of Monday, but almost all of Monday to do. With the new system, essentially, Monday morning, it's up and ready to be used. All the crunching has happened overnight with the data, so we have all the appropriate information. As I said, the second area is dealing with information that we have that the staff do. So we saved all that time. And the other thing is to provide new information and deeper metrics. Now that the system's doing it, the calculations that happen automatically, we're able to dig much deeper, down to the retail level. Because obviously we have 21,000 points of purchase, so we can't, publish information on all those locations. It would just take too much staff time. But we were able to identify the types of retailers or the specific retail places that are not selling the proper games, and as they're not optimizing their sales because they're selling the games that probably aren't selling very well in the state. So therefore our sales force could concentrate efforts at getting those retailers to display and offer for sale the games that would maximize their sales. And as a result, that's how we saw increases in sales, by getting retailers to display the correct products that will maximize their sales, the products that people want, essentially. And that's what every retailer wants, is to have products that customers value. And I think by having our entry into big data, by solving the critical business issue, being able to immediately show value to the organization by focusing on things, I think that's really helped us in terms of our initiation of our big data strategy.
Mm-hmm. And I'm sure many public agency, like the same challenge we're all facing, that we're always being asked to do more with less. And with the whole data strategy, how do we do BI, how do we do business analytics, many organizations may be still in the realm of treating that as a project. Like there's a begin and end day over a year, you need to return some demonstration of return on investment and therefore keep it going. John, could you elaborate a little bit more on, what are some best practice for establishing a ROI around the data strategy?
Yeah. Good question. Don't look at big data as a one-off project, right? It's a journey. And you need to start small with some initial success, as Jim pointed out, and really prioritize what's most important to you, right? In the near term, in the midterm, and the long term. So I'll just go back to the keynote. Pamela had mentioned 39 indicators. That's a lot of indicators. So where do you begin? Right? She got it down to 3, and she focused on those 3. If those are the 3 most important ones, then relate that to the data that you need. Remember, she said that I need to be able to access some of the data that I have, some of the data I don't have. What's it going to cost to get that data? What's it going to cost to prepare that data for analysis, to integrate it, to cleanse it, to make it fit for use, right? You mentioned the tooling as part of your big data strategy. So, gradually build out your enterprise architecture. There's reference architectures available today. There's big data has been in the news now and has been developed and evolved over the last several years now. So you're not starting from scratch. You don't have to feel like you're a guinea pig. However, there are, the horror stories of entering into this trough of disillusionment, like any hyped up term. And so how do you avoid that trough and become successful? And so you do need to establish an ROI. But then the challenge is, well, this has never been done before. There's a little bit of a discovery, iterative approach to proving the value. And that's why you need to start small with an initial project, prove the value, get executive sponsorship so that it has visibility, and others will see that as a success and want to support you in that. And then you can continually increase the value and build out the infrastructure you need. For example, maybe you start off by lowering the cost of your infrastructure, since you're dealing with larger volumes of data, different types of data. So what we've seen in particular as a starting point is optimizing their data warehouse environment to store more data, to process more data at scale in real time. And as a result of that, they've been able to lower their costs by a factor of 10x in some cases. And that'll help self-fund future projects. The other thing that I'll point out is that there's this concept of realized value or realized ROI. So much of what we're looking towards in the future is the information potential, right? Because there's all these unknowns, we don't know what we're going to discover, right? When the data scientists start looking at the data and looking for patterns, they're going to discover some new and interesting things that you never thought of. What's the value of that? You can't predict it. But so it's a journey. You start with one project and you march forward with other projects. And some of them aren't going to pan out and others will. But overall, the averages, you'll see an increase in your ROI.
That's great advice. Just on a time check, we're probably at about 5 to 7 minutes before we need to wrap up the session. So instead of going down further on some of the topics, I'd like to open up to our audience. Are there any questions or any feedbacks or comments that you guys like to ask our panel members? Yes.
Linette, Dr. Scott, you mentioned about measurements, outcomes, how our services are impacting, is there value in the services we're providing? As we move forward, we realize that that information doesn't only come from health, it comes from criminal justice, from housing, from education. Is there some type of strategy to adopt a national standard for information exchange, like NEAM, for instance, as part of our model to be able to share across different business lines and different disciplines?
Yeah, so the, just to make sure folks hear the question. So part of the question is really where are those standards that intersect across different lines of business? I mean, I think it's kind of the underlying piece there. And in health, Pamela alluded to this. One of the things that we cite frequently, for your health, only about 10% of it perhaps is impacted in the doctor's office. The other 90%, it's about where you live, where you work, what you do every day, the choices you make around whether you're physically active, whether you eat this item or that item. Those are the things that really impact your health. And so part of the Let's Get Healthy California Task Force had this component around healthy communities. And and public health in particularly has done a lot of work over the years around these different intersections. So one of the things that you mentioned, NEAM, National Information Exchange Model, it actually started to come out of the response to the 9/11 scenario and really out of the law enforcement emergency response environment because they found they weren't able to communicate as effectively as they wanted to. And so with NEAM, there are a variety of different areas that touch on different specialties or lines of business. And the goal, though, is to have that crossover. So there's a lot of work around standards in terms of helping to cross between different organizations. And yet there's still a long ways to go. So yes, there is work in that arena. But part of this, part of the bridging is what is it that you really need to link versus what do you just need to know about an association. One of the other aspects in the data strategy environment is it's really tempting to say, gosh, I'd like to get all the data sets and put them in one big data warehouse and it's all linked and ready to go. But it's not realistic for so many reasons. And perhaps one of the biggest reasons, and rightfully so, is the concern around things like privacy and confidentiality. So there's not going to be a single data warehouse in the sky. It's more about how do we federate information and look at information from a de-identified perspective and how that relates. And just because it's not linked doesn't mean there isn't value. And one of my favorite examples, sort of from a geospatial health background, is in the I think it was early 1900s. There were folks that were mapping the deaths due to yellow fever in the New York Harbor, and they tacked those up, and they took their maps and they said, "See, here's the proof. It's those bad smells from the water that are making everybody get yellow fever. We've got to clean it up." And they did, and the yellow fever deaths went away. Now, the fact that yellow fever is transmitted by mosquitoes that live in the dirty water was not known to them, but the effect was the same. People stopped dying of yellow fever. So understanding the true underlying cause isn't always the most important thing. In our scientific heads, it is. But from a practical perspective, sometimes it's just knowing that you've got the right associations and you are getting those outcomes, even if you haven't done the linkage. So both things, I think, are happening. How do we federate? How do we have data that we can access from different perspectives? But also then how do we start to think about measurement in different kinds of ways, too? So absolutely. How are we doing on high school graduation? How are we doing on crime? Those things have direct impact on health and vice versa. When you're not sick, you can be a more productive person to society. So yeah, it's a fascinating environment.
Thank you. Any other question? Yes.
I'm sitting on a dilemma with being a government agency and sitting on tons of mountains of data. The things that between confidential data we collect and publishable stuff, there's to be in between that we want to move to the public and make it available to add value to the society. But that needs to be cleansed, needs to be linked, needs to be, well, there's a lot of information, there's a lot of problems with it. But being a government agency, we don't have the funding nor we have the staff to sit and cleanse all this data, managing this data. So that's not our task.
Right.
But we sit on tons of data and we want to move it out. That's a dilemma that we're dealing with. Do you have any comments on that?
So maybe John, you want to chime in?
Yeah. You know, the most successful organizations build out data integration and data quality as a core competency, because you're going to have to do that over and over and over again for absolutely everything you do with respect to analytics. In fact, 80% of analytics is, you know, first finding the data based on the metadata, if you have the metadata, accessing it, integrating it, cleansing it, matching it, normalizing it, standardizing it, and then you can, you know, analyze it or visualize it. So having that as a core competency, whether it's centralized or, I mean, you can centralize it in different ways. You could have centralized skill set, centralized infrastructure, or just some best practices that are published for you to use, right? That's going to be a critical core competency that you need to bring into your organization to be successful.
In the interest of time, I'm going to ask the panel member to maybe give some closing thoughts of all of the things that we discussed. You know, why is it that there's a need for a big data strategy organization moving forward? What's the way to initiate it? What are the ways to demonstrate return on investment in order to sustain the program? And, you know, what are some measurable, you know, measurements we can put in to continue to advocate for this journey of big data strategy that each organization goes through? So maybe with that, if each of the panel members to take about 30 seconds or so. Jim, I'd like to start with you.
Well, I talked about how to initiate in terms of focus and providing immediate value, and I think even in sustaining that strategy, it's essentially the same thing. It's by, but with a longer-term vision in mind. So, you know, after you have some of the initial successes, then it's to really figure out long-term, how are you going to develop your data strategy to involve more business units, to involve more business decisions. And I think that's kind of the way to kind of go from initiating it successfully to sustaining it. And yet it's a similar fashion, because you really are focusing. It's just that you have a longer-term view of a longer-term roadmap by sustaining it.
Dr. Scott?
I think one of the takeaways I hope people get from today is thinking about data strategy, and data as an asset as a distinct activity that's separate from your business activities and your technology activities. My role as the Chief Medical Information Officer in the department, it's a new role that's only been there for about a year and a half, and it's part of that conversation around having a data conversation that's about the data, and recognizing as a distinct activity, as a distinct asset, something that we need to take care of, use, cultivate, all the things that we've been talking about. So that's something I hope is a takeaway from today, as people talk about big data, to really understand what it means to collect, to analyze, to store, to use, to communicate, to de-identify, to make appropriate, and to explain. Because you can post it and then get tons of questions, and that wasn't helpful either. It's a whole area of work, and I think as government entities, we have a particular responsibility around doing that. Some of our organizations, it's more explicit than others, but it's part of our role as government and being taxpayer funded, that we do get as much information as we can available in appropriate ways. And so there's a whole area of work around that we need to have lots of partnerships around, and look forward to doing that.
Thank you. John, last word?
Sure. So big data, to me, it's just data. So all the skills, data skills that you have today are relevant. Yes, there are some new skills that you should learn, And don't just look within public sector, look outside of your industry, look at financial services, well, of course, healthcare, manufacturing. There's a lot of things that you can learn related to predictive analytics, related to, data strategies. So that would be my 30-second advice is, keep learning. The skills you have today are still relevant, and you're just building on top of that.
Mm-hmm. Thank you. I hope everybody had a chance to enjoy. Let's give a big round of applause to our panel members.